Managing allergies is a common concern, and for individuals with diabetes, it is crucial to understand how allergy medications might affect blood glucose levels. Zyrtec, known generically as Cetirizine, is a widely used antihistamine. This video examines whether Zyrtec is a safe option for those managing diabetes. Cetirizine is a second-generation antihistamine commonly prescribed to alleviate symptoms associated with allergic reactions such as sneezing, itching, and runny nose. Unlike first-generation antihistamine, cetirizine is less likely to cause drowsiness and has a more favorable side effect profile. The impact of cetirizine on blood glucose levels has been the subject of various studies. There are two categories: human studies and animal studies. Okay, let's take a look at human studies. A study published in the Indian Journal of Otolaryngology and Head and Neck Surgery investigated the effects of different antihistamines on blood glucose levels in patients with allergic rhinitis. The findings indicated that cetirizine produced a significant increase in postprandial blood glucose levels and a slight rise in fasting blood glucose levels. When it comes to animal studies, research published in Uppsala Journal of Medical Sciences explored the effects of cetirizine on glucose metabolism in mice. The study found that cetirizine improved glucose tolerance in mice fed a high-fat diet but did not affect insulin sensitivity. First, monitor blood glucose levels. It is advisable to closely monitor blood glucose levels when initiating cetirizine to detect any changes promptly. And consult healthcare providers. Before starting cetirizine, discuss it with the healthcare provider to ensure it is appropriate for your specific health situation. While cetirizine is less sedating than first-generation antihistamines, some individuals may still experience drowsiness, which can affect blood glucose monitoring and management. While cetirizine is effective in managing allergy symptoms, individuals with diabetes should be aware of its potential impact on blood glucose levels. Close monitoring and consultation with healthcare providers are essential to ensure safe and effective use of this medication.